and welcome. You're watching Health and Wellness. It is important to live a balanced life, and our health and well-being play an important role in this. Now, every day we're warned about many devastating diseases. However, one of the deadliest is heart disease. Heart disease is the number one cause of death in men and women worldwide. More people die from it each year than from all forms of cancer combined. For instance, heart disease doesn't only occur in older adults, it's also affecting younger adults more and more. And what is more threatening, heart disease can cause death instantly. The main reason for heart-related diseases is the lack of awareness on what to do in a cardiac emergency. Educating the public about the signs of a heart attack and cardiac arrest and the importance of taking immediate action to improve survival can minimize the damage that can occur after a heart attack or a cardiac arrest. People with heart diseases, however, are at a higher risk. However, cardiac arrest can also occur without warning in people who appear healthy and have no known heart disease or other risk factors. Most cases of sudden cardiac arrest occur outside of hospitals. It is most often what happens at home and in public. We can reduce the mortality rate through awareness and bystander intervention. Life-saving techniques such as cardiopulmonary resuscitation can give you the opportunity to save a life. Save a Life is an initiative to make people aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time, be trained in resuscitation if the need arises. Today we have eminent cardiologists with us to help you understand sudden cardiac death and the role of CPR. Dr. T. Nilambujan, Senior Consultant and Interventional Cardiologist, Sundaram Aluraj Hospital, Tuticorin, joins us. We also have Dr. Satyasham Toshniwal. He's an interventional cardiologist from the Sri Ram Heart and Eye Care Center, Solapur. And we have Dr. Vineet Kumar, consultant interventional cardiologist, Heart Hospital, Patna. Thank you very much, doctors, for being with us. Dr. Nilambujan, if I can begin by asking you, cardiovascular diseases are a group of disorders that affect the heart and the blood vessels. Which cardiovascular diseases is the deadliest and why?
Acute myocardial infarction, that is in medical terms, or in common layman term, which is called as heart attack, is the deadliest form of cardiovascular disease. Why? Because of the two reasons. Number one, it has got a very high mortality rate. That is, the mortality rate is around 20%. That is, 1 in 5 patients with heart attack are going to die. So we have a very important problem on hand, which is facing us. And more so, some of these patients don't even reach the hospital to get the treatment. They die suddenly on the way to the hospital. Number two, if you look, Indians are basically predisposed to the development of heart attacks, mainly because of the genetic predisposition, as well as the metabolic predisposition, as well as due to the faulty lifestyle. So, and again, if you look, Indians develop heart attack at least 10 years younger when compared to the Western counterparts. So we see clinically heart attacks at the age of 20, 30s. So this affects mainly during the productive years of a particular person's life. On the positive note, if you can do something on the lifestyle modification with diet, exercise, as well as good habits, you can prevent most of these heart attacks and also the sudden deaths.
All right, I think that's really important to understand. Dr. Toshniwal, if I can come to you now, can you explain to our viewers what is sudden cardiac arrest and what are the common causes of a sudden cardiac arrest?
Sudden cardiac arrest means it is a sudden stoppage of the heart leading to stoppage of respiration and stoppage of your mentation that causes sudden fall on the ground, and it's a cardiac emergency. So we have to be very immediate, we have to take immediate action, and that is due to the main cause is abnormal heart rhythm, which is called as arrhythmia. That is a ventricular fibrillation. So we have to be very active enough to give immediately CPR, which is causing to life to the patient. So most common threatening arrhythmia is a ventricular fibrillation, and we have to be very active enough to cause. And causes of the ventricular fibrillation is main acute heart attack, which is secondary to the coronary artery disease, and that causes cardiac arrest. Another causes are congenital heart diseases, loss of blood, metabolic causes, and any previous history of the heart diseases which are causing cardiac arrest. So these are the main causes of the cardiac arrest.
Right. Dr. Kumar, since we've just discussed sudden cardiac arrest and we know it's a deadly condition that occurs when the heart unexpectedly stops beating, are there any symptoms for this condition that people should be aware of so that they can get early treatment?
Yeah, definitely. In some cases of cardiac arrest, we are usually not getting any symptom at all, but some people are definitely getting some symptoms. These are usually not very specific for the sudden cardiac death, but we should be aware for that. Just like anginal pain, dyspnea, palpitation, or some lightheadedness or syncope-like things is there. Although these symptoms are usually occurring weeks to months before the acute event, so we should not ignore these symptoms. If these symptoms are occurring, we need to give the medical attentions or need to investigate with due course. Otherwise, these symptoms are going to be into ultimately might be possible that those individuals will go into sudden cardiac death.
Right, Dr. Nilambajan, what steps should a bystander follow if you recognize that someone is having a cardiac arrest?
Actually, if you see, early recognition is very, very important. Sometimes it could be really challenging. You might see a patient who might be unconscious or unresponsive. That could be a cardiac arrest. And if you encounter such a situation, what you should do is you should look for the respiration. There might be an absence of spontaneous respiration, or else there could be some snores form of breathing or agonal breathing, or sometimes there could be some gasping, which is not enough to sustain the life of that particular patient. Don't waste your time looking for the pulse, because sometimes it is very difficult to look for the pulse in such a sick patient, and don't try to sprinkle water or making him drink some water. That is all something which is commonly done by the public that you should not do. What you should do is try calling for help if it is available in the vicinity. If you can get some bystander, it is always good. Or else, if you have a mobile, take your mobile and call the national emergency number, which is 108 in most of the states. You can try doing that, and don't waste your time trying to call for the help. What you should do immediately is you should simultaneously start the CPR, that is the cardiopulmonary resuscitation, by initiating the chest compression. The chest compression should be very fast, at least 2 per seconds. That means you have to give at least 100 to 120 chest compressions in a minute. And if you're familiar with the respiration, you can also provide respiratory support by giving a mouth-to-mouth breathing, where after every 30 compressions, you can give 2 breaths. If you're not familiar with the mouth-to-mouth breathing, don't bother, just keep giving the uninterrupted high-quality chest compression. This alone can sustain the heart, sustain the neurological status, as well as improve the recovery from the devastating event.
Right. Dr. Toshtiwal, how would a bystander, a non-medical person, know if he or she is doing CPR with the right technique? For instance, what are the main steps of CPR?
Yeah, exactly. Whenever patient collapses, now it has to be, we should see the that area, and we should make the patient flat. And once the patient is flat, you just for a second or 1-2 second, you should see the pulse. If it is not there, then respiration. If it is not there, within 5 seconds, you should see pulse, respiration, and his status, mental status, and start compressing the chest by extended your hands with one hand and another hand on the same hand, and put your whole of the weight by kneel position, and compress it by 80 to 100 times in a minute. In between, you should just watch that he is taking respiration once in a 15 seconds, once in a 10 seconds. And if it is not there, then immediately go for another fellow to tell that do mouth-to-mouth respiration, which is very rarely required. But you should compress the chest at least 2 inches down the line, and immediately just decompress the chest, compress, leave that, and they again compress, so that there should be a gap of almost a few fraction of seconds. So your compression should be at least 2 inches it should compress the chest, and there should be fully again reinflation of the chest, then again compress. So that is the way you should see that, and immediately just ask somebody to just call some ambulance or medical person or somebody, so that he should have some breath or some injections or something which can be saved the life.
Right. I think that's really important advice as well. Dr. Kumar, can you damage someone's heart if you perform CPR while it's beating? What are the negatives of it?
No, it's not at all. The old belief was there, never do the CPR on the beating heart is not wrong. It's already established that doing CPR on the beating heart, there is a very rare chance of any damage to the heart. So it is recommended that better safe than sorry approach. So definitely it's always better to do some unnecessary CPR, chest compression on a beating heart, rather than withholding the CPR or the chest compression and circulation with someone whose circulation or heart is already stopped. So it's definitely better to give some extra compression if we are in a doubt, rather than withholding and going to see the heart is beating or not beating. Because for an ordinary individual, it's very difficult to establish heart is beating or not beating, because very oftenly we are usually feeling our own pulses as that individual's pulse. So this is a common mistake that a usual common person is doing. So it's always better to do CPR whenever we are usually finding any unconscious person.
All right, important advice there on CPRs and what to keep in mind. We're going to slip into a short break. We have a lot more questions on the other side. Stay with us. Welcome back. You're watching Health and Wellness Save a Life. Our panel of expert doctors continues to be live with us. Dr. Nilambujan, what are the legal ramifications of giving CPR, and what are the CPR guidelines in India?
Actually, if you see, there are a lot of misconception, hesitation, and anxiety on the part of the bystanders whether they can really give us the CPR or first aid during the times of emergency, especially if they are from a non-medical background and if they don't have a certification for doing a CPR. Actually, if you see somebody who is willing to come forward and help in an emergency, according to the legal system, they are considered as good Samaritans, and they are protected by the Good Samaritan and Bystander Protection Law, which has been gazetted in the Gazette of India in May 2015. And these people are all exempted from any form of lawsuits, both civil as well as the criminal. So they are totally protected. And when you encounter such a situation, unfortunate situation, if you happen to encounter in future, be the first person to raise your hand and start the chest compression. You are legally safe. Coming to the second part of the question regarding the Indian guidelines, what we follow is the American College of Cardiology, American Heart Association guidelines, which has been customized to our population by the Indian Resuscitation Council under the aegis of Indian Society of Anesthesiology. Whatever the guideline is, basic is you have to follow the uninterrupted high quality chest compression, which can really save the life of the patient.
Right, Dr. Toshdewal, what precautions should existing heart patients take while they are traveling?
Okay, it's a very good question actually. The thing is, thorough patients who are suffering from the heart diseases, they should undergo first of all thorough cardiac checkup, I should say, so with a cardiologist or physician before anywhere they are traveling, by train or by aeroplane or by road also. So thorough checkup, and once they permits, physicians or cardiologists permit, then only they are supposed to travel. Even though if they are traveling, they should have their phone numbers of their own close relative, and along with that the contact number of the cardiologist whomsoever he is showing the patient is showing the cardiologist, and he should have a card of mentioning the detail about his disease and the likely he will develop such and such thing. So everything he should have along with one card along with him. And second thing, once they travel by air, they should have frequent walking in the passage of the plane. And third thing, they should drink good amount of water. They should not do any more activity. They should not strain for the stool and all everything. So these are the main things which has to be kept in mind while traveling. Even though they some people will be traveling along with the ICD, means defibrillator machine also. Some VIP people will be traveling along with the defibrillator machine. Even on traveling also they are getting some arrhythmia. So I saw the patients which are getting reverted with the DC machine. That's called a defibrillator machine. So these are the precautions we should take to save the life, and it's the most important.
Right. Dr. Kumar, why is it important to learn cardiopulmonary resuscitation for everyone? Why would you recommend it?
Yeah, it's very, very important things, because sudden cardiac arrest can happen at any time, any places, like in the market, in the mall, on the road, or during buses or train, or anywhere out of the hospital setting. There the all usual general individuals will be near about, and it's not possible for the medical help to be reached very early. In case of sudden cardiac arrest, if we can start early intervention, or we can start early CPR, definitely we can able to salvage more and more, and we can able to decrease the brain dead part also. So if any individual is saying any cardiac arrest, immediately start CPR, and some that will definitely inform for medical help. If we can maintain the circulation in between medical help is coming, that is a great relief for that arrested individuals, or their recovery chance will be very high, as well as their brain death chance will also very much less. So it's very important. It should be learned by every individual.
Right. Dr. Lambujan, what is the recommended first aid for chest pain? Does everyone who has chest pain perhaps have a heart emergency? Is every instance of chest pain indicative of a heart emergency? How would you explain it?
Yeah, every chest pain is not a cardiac related one. Every chest pain is not an emergency. There are some 25 to 30 causes of chest pain. It could be a simple muscular pain. It could be a pain from your gastric system or from your lungs, or it could be a dangerous problem like your heart attack or some problem with the main blood vessels. So anybody having a chest pain, basically they should not panic, but at the same time they should not be reckless. They should be alert enough and get them checked. If you have a chest pain and if you strongly suspect that it could be a heart attack, that means if you have a strong family of heart diseases or diabetes, or if you are at a high likelihood of developing a heart-related problem, and if you have symptoms which are more in correlation with the heart attack, you can suspect a heart attack, and you can do is take a chewable aspirin, which can be chewed, which is the first important step which every patient should do. And immediately what they should do is they should go to the hospital, get an ECG done and get it clarified whether that is a heart problem or not. If it is a heart problem, they'll advise you to get admitted and get treated. If it is not a heart problem, they'll probably advise you accordingly. What I want to emphasize is not to self-diagnose every heart problem as a gas problem, ignore it, and finally land up in a problem. So any heart problem needs to be evaluated accordingly.
Right. Dr. Toshriwal, what is an angioplasty and why does one need it and when does one need it?
Yeah, this is very good, this thing. So angioplasty, once the patient come with a chest pain, ongoing chest pain, which is a severe and it's like severe long duration chest pain. So immediately what we do is we take him for the primary angioplasty called as. So angioplasty means opening your heart is supplied by the three main coronary arteries. So one of the arteries getting blocked, then we have to open that artery and restore the blood supply to the myocardium. So once opening that artery is very important, and that if it is been delayed, then heart will get damaged forever, or it might give rise to arrhythmia and sudden cardiac death. So opening that coronary artery which is causing a heart attack is called as angioplasty. To not to restore or again blockage that artery, we have to put a spring-like structure over there in that artery. That is called as stent, mesh-like network over there. So there are nowadays there are many people who are coming for the primary angioplasty, which is called as within 2 hours, and then rescue and then elective angioplasty, and that is the mainstay of the treatment of the coronary artery disease, mainstay of the treatment of the heart attack. So multiple stents, multiple angioplasty, these are the almost alternative to the bypass operation, but they are better than the bypass operation, so that patient will have without any anesthesia, without any problem, the total recovery, and the patient will remain asymptomatic throughout his life.
Right. Dr. Kumar, what can one expect after undergoing an angioplasty?
Yeah, it's a very good question because a lot of apprehension is there after that. We are usually expecting a almost normal life after angioplasty. We need to continue the medicines like the antiplatelet and statins as advised by the doctor. That should be continued for the lifelong according to the doctor's advice. Second thing, we need some healthy modifications in the lifestyle. That is very important so that the lesion will not develop in any other artery or the stent will not going to block anymore. These healthy lifestyle modifications is very small. It should be emphasized. Like our dietary modifications, we need to usually take the healthy diet. We need to do the regular walking and the exercise. American Heart Association is usually recommending half an hour walking daily. It should be done by every individual, not for the only heart disease. And we need to avoid the smoking, alcohol or any other substance abuse behaviors. That is also very, very important. Only these things should be advised. We need to continue medicine. We need to modify our lifestyle. After that, we are usually expecting a normal life after angioplasty.
All right, very important clarifications coming in on a whole host of issues. Thank you very much, doctors, for sparing your time and joining us on NDTV. That's all the time we have. Short break here. News continues on the other side.